I'll just quickly speak about TB. The BCG vaccine is recommended, but only for children under 5 years of age who are going to be spending 3 or more months in an endemic country. This is only accessible through chest clinics in New South Wales, but there is currently an international shortage, so there's quite limited availability, both Australia and overseas. So we are using a different product at the moment, a Polish-produced product, and looking at importing one from India. So that there could well be difficulties accessing BCG vaccine at the moment. But chest clinics can give advice to families if they're not able to access the vaccine before they travel. And of course, this is another live vaccine, so particularly in this age group, it's important to kind of line that up with their MMR or MMRV before they travel if they haven't had those vaccines.
And you certainly don't want to give BCG to someone who's immunocompromised.
No.
Just a little bit about the older or chronically ill traveller. As we said earlier, quite a lot of older people, old people with chronic illnesses are travelling. So think about, trying to make sure they're protected against things like influenza. They're up to date with pneumococcal, the zoster vaccine, hepatitis B. Also, they may not be immune, and the others will depend on risk assessment. And we've mentioned that yellow fever vaccine, that there is that higher risk of adverse events in older people. Moving on to just a list of travel vaccinations in children. This is just recommended lower age limit. It's just a sort of aide memoire slide in terms of the various age which you can start giving those vaccines. With the yellow fever, you might notice that the immunisation handbook says 9 months. The product information says 6 months. In Australia, we prefer to use the 9 months as the starting age for that one.
Yeah, and if I could just point out the MMR, it's unfortunate the number of children that we do see coming back from the subcontinent just about 12 months of age with measles. So if they are travelling before their first birthday, it's perfectly acceptable to give that vaccine as early as 9 months to provide that added protection when they're in a high-risk travel setting.
Yeah, that's an important point, yeah. And just keeping going...
Just to clarify...
Yeah. Sorry.
So I was just going to say, to clarify while we're on the children's slide, we did have a couple of people asking earlier about typhoid vaccine in children under 2, and just commenting that that's outside the licence, and just clarifying that, and I think that's what it said on that slide.
Yeah.
Yeah. It's not known that it's harmful or dangerous, but there isn't the safety data, so that's always that issue with off-label use.
Thank you.
Just keeping going here, you can see that for Japanese encephalitis, there's slightly different dosage for younger kids with Jespec, and you can see the lower limits for meningococcal for the conjugate vaccines that we talked about earlier.
So Tim, I just wanted to give, in this context of travel, it's not about vaccination, but just an update about Zika virus, because it's still very important that we're all familiar with the current situation. So it's a flavivirus. It's very similar to dengue and mainly transmitted by Aedes aegypti, which is the yellow fever mosquito, but we believe that Aedes albopictus is also a competent vector. And as we learn more about it, we're finding that sexual transmission is possible and mother-to-child transmission is possible, but mosquito-borne remains the predominant means of transmission. Now, just in the past couple of weeks, the World Health Organization has confirmed the association with severe congenital neuropathic effects in infants born or to women who've had Zika virus infection during pregnancy. And there's also an emerging association with Guillain-Barré and other neurological syndromes in adults, and they remain under investigation about the strength of that association. So the presentation of Zika virus, its onset 3 to 12 days after a bite, and symptoms last from 4 to 7 days. It's emerging that rash is probably the commonest presenting symptom or sign. Fever also common, but not as common as rash. Headache, retroorbital pain, non-purulent conjunctivitis, myalgia and asthenia can be quite marked. But important for the epidemiology to note that about 80% of infections are asymptomatic. The next slide is the most recent map of countries with active transmission. So we're looking at most of Central America, the Caribbean, and a fair chunk of South America. But we've also got active transmission reported in New Guinea and other Pacific islands. But in counselling your patients about pre-travel advice about Zika, I'd really encourage you to check the latest information, and the Commonwealth is keeping that updated on their website, because it is such a dynamic outbreak and affected countries can be changing within days or weeks. We have good testing for Zika virus in New South Wales, and encourage you to talk with your local pathology provider or ID specialist about the right test for your patients according to the time since symptoms and travel and so forth. We're usually in the acute phase needing to exclude other infections such as dengue and malaria. But depending on the time since symptoms, we have a PCR available, or we may need to use serology to confirm infection. And this is all done at ICPMI at Westmead. Look, really importantly is this travel advice, and I can't say it enough times. Pregnant women should defer unnecessary travel to regions with active transmission. And then all travellers to affected areas should take very stringent precautions to avoid mosquito bites. So the basics are there: daily application of repellent with effective chemicals, whether that's DEET or picaridin, and it's important for your patients to know these are day-biting mosquitoes, so they need to put this on every morning. Try to make sure they book their accommodation that has fly screening, and if they're in really high-risk situations such as camping and so forth, getting their clothing treated with insecticide. So we've got all that information summarised on a fact sheet that you can access and give to your patients. And then for people who return, so if women have travelled to areas with active Zika virus and they are pregnant, there's very specific advice issued from them for them, and that's detailed on the Commonwealth website. But basically they do need assessment to see if they have been infected with Zika, either clinical or subclinical infection. And again, encourage you to visit the website, because this information and guidance will be amended as information emerges about the best management for women. Then for men who've travelled to areas with active Zika virus infection, we're recommending that if their partner's pregnant, whether or not they've had symptoms, they should abstain from sex or use condoms for the remainder of the pregnancy. And then men who've had confirmed Zika virus infection who should abstain from sex or use condoms for 3 months, and this is to prevent sexual transmission.
Okay, there's a range of resources available to kind of help and for decision support in travel medicine. There's a list here, the WHO site and the World and the CDC site probably being the best known, but really these are really useful websites and can help you very much in providing good quality advice to your patients. So I certainly encourage you to have those, on your browser so you can click on them easily, and it can be very useful to go through some of that information with your patient as part of the consultation. Maybe print out some of the materials for them to take home and do some reading afterwards. So we won't go through them, but they're there, and certainly hope you'll use those.
Excellent, thank you very much. And so I'd just like to reassure people that that list of websites, you'll be sent the PowerPoint afterwards, and so you'll have access to all of those websites and can click through to them, and I think that's going to be crucial. The other information on the slides will also be available to you, and so I know some of the questions that have come through will be answered in the slides. Other questions, I'm just aware it's 10 to 9 now, and so we did have quite a few questions come through, and we shall store those and endeavour to get back to you with answers on those, because we haven't got time to go through them in sufficient detail tonight. I'd like to thank Nick and Vicky for going through such a comprehensive set of useful information over the last hour, and to Penny for doing all behind the scenes that makes it float so easily. So thank you to all of you for doing that. Thank you to everyone for being online and for paying attention and asking excellent questions. As I say, we'll get through to those. And a reminder that 14th of September there's another vaccination update, this time on shingles vaccination. And so contact the New South Wales faculty to register for that online as well. Thank you very much indeed. Any final comments from Penny or from Nick or Vicky?
No, thank you. Thank you very much
Thanks,
for another fantastic webinar, and thanks to Vicky and to Nick as well. Good night.
Thank you very much. Have a good night, everyone.